Welcome back. We'll continue the topic health insurance. Health insurance is in India, it is covering only 10% of the population, and here you are paying the fee that is called premium. Okay, in broader sense, it would be an arrangement that helps to defer, delay, reduce, or altogether avoid payment for health care incurred and household. If any problem occurs related to the health and household, then this insurance will be provided by these companies. What are the categories? Voluntary health insurance schemes or private for profit schemes. That is the first one. Second one is employer-based scheme. Third, insurance offered by NGOs, community-based health insurance. Fourth one is mandatory health insurance schemes or government-run schemes. So moving to the first one, voluntary health insurance scheme or private for profit scheme. It is given by the private insurance companies, and it pulls the people with similar risk and insurance them for the health expenses. In the public sector, the two major companies under the categories are GIC and LIC. This is given by the private companies, and if any health related risk and the people suffers any problem, these companies will give the insurance. And the two categories mainly coming under this are GIC, that is General Insurance Corporation, and LIC, Life Insurance Corporation. What is GIC? It was formed on 1st January 1973. Under this, there are four companies comes. Those are National Insurance Corporation, New Delhi Insurance Corporation, Oriental Insurance Corporation, and United Insurance Company. So these are the four companies coming under the GIC. The policies offered by this first one is personal accident policy, that if the person suffers any accident and the injury is external, visible, and violent, then this company will give you the insurance, and dependent is should be 5 to 70 years. And capital sum insured can be restricted to 72 months income from gainful employment. If the person is an employee, then the insurance will be restricted to 72 months, and here shares and property of the person will not be accounted. And for the working spouse, only 50% of the sum will be given, that is 1 lakh. And for the dependent children, 25% of the sum is insured, that is 50,000. The eligibility people are employees of central government pensionaries, widows of central government employees, Delhi police employees, and defense employments. What is the entitlement? The first level of consultation and the preventive health care will be given through the dispensaries and hospitals coming under this scheme. And CGHS dispensaries, polyclinics, or CGHS wing at a recognized hospitals will give the consultation, and treatment will be given through the special referral or emergency treatment in private hospitals outside India. What will be the reimbursement? The reimbursement of consultation fee for up to 4 consultations in a total spell of 10 days, that is on referral. Cost of medicine and charges of maximum of 10 injection will be given through this scheme. Moving to the ESI, that is Employee State Insurance Scheme. We have seen this already. It was formed in 1948, and it is given to the employees, and the benefit coming under a sickness, maternity, disability, death benefits. Okay. And the eligibility and contribution, everything we have seen already. Entitlement also, even the reimbursement. Moving to the Navsajan, it was established in 1988, and its focus was the Dalit community. Only for Dalit community this was given. And unearth atrocities against Dalits and fight against these atrocities by providing legal assistance so that Dalits can lead a life of self-respect and dignity. Okay, Navsajan is mainly concentrating on the Dalit people, what we call SC and ST, I guess. Okay, and they will help in the legal assistance. Today, it is working in 11 districts of Gujarat and had a team of 194 workers. Health insurance idea was brought in by the enthusiastic and committed worker of Navsajan. Hence, it decided to buy the mid-claim policy from New India Assurance and pay the premium. Okay, this bought the mid-claim, and itself it pay the premium for the welfare of the Dalit people. and coverage amount was up to 15,000, and the premium was 175 per member. What are the other community-based insurance? Those are Mallur Milk Cooperative, the Action for Community Organization, Rehabilitation and Development, Kadamalai Kalanjia Vanara Sangam, Raigar Ambikapur Health Association. These are the other community-based insurances. And social insurance or mandatory health insurance schemes or government-run schemes are, there is no universal health insurance schemes in India. Okay, and the health insurance at present limited to the industrial workers and their families. Only for the industrial workers and the families it is given it through the CGHS and the ESI. And the employer-based scheme, public and private sector offered to their employees an employer-based scheme through their own employer-managed facilities by a way of lump sum amount or the payment, reimbursement of employees' health expenditure for outpatient care and hospitalization, fixed medical allowance, or covering them under group health insurance policy. So there is group health insurance policy. This will cover the health expenditure and outpatient care of the person, and the hospitalization, and even the fixed medical allowance will be given through this insurance. About 30 to 50 million people are covered under this scheme. And moving to the Defense Medical Service, they have their own organization for medical care, that is Armed Force Medical Service. The services provided are integrated and comprehensive, embracing preventive, promotive and curative services. Okay? The main aim is prevention, promotion and curation of services. And healthcare of railway employees, the railway provide comprehensive healthcare services to the agency of railway hospitals, health units and clinics. Through the railway hospital and health units and the clinics, this will give the railway employees good care of health. And environmental sanitation is taken care by health inspectors in big station. A chief health inspector supervises the division's work. Health checkup of employees is provided at the time of entry into the service and thereafter at yearly intervals. There are lady medical officers, health visitors and midwives who look after the MCH and school health schemes. What are the insurance offered by the NGOs, non-governmental organizations, or it's also called as community-based health insurance? It allows the pooling of resources to cover the cost of future unpredictable health-related events. Okay? This will mainly cover the cost of future, that is health-related any problem and health-related unpredicted events. So some example under CBHI schemes are Sunt Employed Women Association, that's in the Gujarat. It was established in 1992 and provide health, life and asset insurance to women working and their family working in their informal sector based in Ahmedabad, Gujarat. Okay, informal sector means in their home if they are working, or if their own association if they are working, then any problem occurs, the insurance will be given through this seva. The adult must be between 18 to 60 years to join the scheme. Here the woman has to pay annual premium of 85 per life, and if the husband is there, additional 55 can be recovered. So which and all disease will be covered under this? Chronic TB, certain cancer, diabetes mellitus, hypertension and piles, diseases caused by addiction, that is addiction. Tribhuwanadas Foundation, it is founded by Tribhuwanadas Patel and it covers 638 villages out of 900 villages of Kheda and Anand district. It trained voluntary health workers are giving this Tribhuwanadas Foundation care, and the care named was Sardar Patel Arogya. Only the members of Milk Cooperative as well as Tribhuwanadas Foundation can enroll in this scheme. Okay? And the premium is 26 rupees per year, and they must be deposited at least minimum 300 liter of milk per year. If they are not entitled to the benefits. One more important reason and information under this scheme is, another important clause is that members should not sell any amount of milk to Amul competitors. If they are found selling, they are disqualified from participating in this scheme. So they cannot sell the milk to the Amul company. Next, there are Aga Khan Health Services India, that is given mainly in the Gujarat, Maharashtra and Andhra Pradesh, and it is for the poor pockets through the country. Under this, there are two schemes, that is cooperative healthcare financing, that covers 30,000 rupees, and community health fund, that is of premium 200 rupees. Okay. And one more is cancer insurance policy. It offers around 50,000 rupees plus 5% additional sum insured up to 75,000 for every claim, and the premium will be 200 per year, and the entrance fees is 75 rupees. And Bhavishya Arogya policy covers the age of 3 to 50 years, and the sum will be 50,000 and more. Moving to the life insurance corporation, that is LIC, there are plans. First one is Akshadip plan. It covers them for major diseases, that is cancer, that should be malignant, paralytic stroke resulting in permanent disability, renal failure of both the kidneys, coronary artery disease where bypass has been done. For these people, this will cover. Okay. And the premium, sometime it is it will be coming for the age group of 18 to 50 years, and the sum will be 50,000 to 3 lakh, and the minimum rupees what premium you are paying, that should be 800 rupees per year. There is Jivan Asha, that covers 15 to 18 years, and the policy is made for 15, 20 and 25 years, and sum will be 50,000 to 3 lakh. If the person is survived, okay, there are two options. He can receive 2% of the sum at the end of every 2 years. First, such payment is done on the completion of 3 years of the policy from the date of the commencement. The second option is, together the lump sum of amount will be given, that is, this can be availed 2 times during the policy. Next is Jana Arogya policy. The sum insured is 5,000 rupees only, and the age group is 3 months to 5 years. Overseas Mediclaim policy. This is for the person who is between the 6 months to 70 years, and if any person is abroad on holidays, business, study or employment, can avail this policy. Okay, if you are going for the trip or a tour or any education to anything for the abroad, then you can claim this policy. Okay? If you are getting any sickness, this is very important. Overseas medical policy. And 8 plans are coming under this policy. If you are going USA and Canada for business and holiday, it will be limited to $50,000. And plan 2, A2, that is same as above, except that benefits and increase to $250,000. And if you are traveling worldwide, there will be $1 lakh. And there are B2, plan B2 here, $5 lakh will be given. And plan C, if you are going USA and Canada for employment and studies, you can get $1,50,000. Plan D, again USA and Canada, if you are going for employment and studies, it is $1,50,000. And plan E1, USA and Canada for cooperative frequent travelers, it will be $1 lakh. Plan E2, same as E1, but there will be $5 lakh. Initially cover of 180 days is provided. There is one more Rajeshwari policy. It is the age group for 10 to 75 years, and capital sum is 25,000. if the unmarried woman die due to an accident, and this 25,000 will be given to the nominee. One more important is mid-claim policy. It was introduced in November 1986, and children from 3 months to 5 years will be covered under this, and sum assured is 50,000, and it can increase from 25,000 to 5 lakh. Certain health insurance products from some private insurance companies are Bajaj Allianz. It is like health card. It covers for the 5 to 75 years, and sum assured is 10 lakh to 15 lakh. Okay, for the hospital expenses. And critical illness policy, there are levels. First level, that is rupees 5 lakh. Level 2, 10 lakh. Level 3, 20 lakh. And level 4, 25 lakh for the hospital, radiological, histological, lab evidence covering. Next is hospital cash daily allowance policy, that is cash of 500 to 2,500 for each day of hospitalization will be insured, and it is for 30 to 60 days will be covered. ICICI Lombard, here the age group 5 to 80 years, and sum insured is minimum 50,000 to 5 lakh, and it covers the expenses up to 30 days. ROVAL Sundaram group, here the ROVAL Sundaram group, the premium is 125 rupees per year, and it will cover the adult age up to 45 years, and the children 65 rupees per year. Benefit will be 3,000 rupees. Okay. There is CHOLAMANDALAM General Insurance. It is given by the Chola Health Insurance, and coverage is it covers around 1,400 hospitals across India, and it will give health related coverings. Age limit is 1 to 70 years, and it covered till age of 70 years, and medical expenses for 60 days. Next is Star Super Surplus Insurance, that is paying around 7 lakh to 10 lakh rupees for the health insurance. Policy premium is 5 months to 65 years of the people. Policy benefit, the room rent for 4,000 per day. It covers ICU, medicine, diagnosis charges, also covers boarding and nursing expenses, and other hospital related things will be insured by this policy. Next is HDFC Standard Life Insurance Corporation Limited. It covers 6 to 55 years, 6 months to 55 years, and the sum insured is 1 lakh to 5 lakh. Coverage, it's related to the hospital, 100% payment will be there, and ICU it pays extra 10,000 per day. Other companies offering healthcare insurance are Apollo DKV Insurance Company Limited, Agricultural Insurance Corporation of India Limited, Bharti AXA General Insurance Company. So like this, there are many. And the Workmen's Compensation Act 1923, this is applicable only for those areas where ESI schemes is not working. Okay, only ESI scheme. If the city is not having ESI, then it will cover those areas. It is given by the labor court. It's not functioning well because of illiteracy on the part of the employees. Next, Rajiv Gandhi SHRAMIK KALYAN YOJNA. ESI Corporation has launched a new Yojna for the employees covered under this ESI scheme. The scheme came into effect from the 1st April 2001. Here, unemployment allowance will be filled by this scheme, and he also eligible for medical care for himself and his family from ESI dispensary, ESI panel clinic, and ESI hospitals. That's what about the health insurance and schemes. We'll see in the next chapter. Thank you.